have a patient lying on the ground, and the first step is you have to be aware of our surroundings, check for danger, D. So we have some danger here. So when it's safe to approach, we can approach. Next step is R, which is response. We lightly tap the shoulder of the person. We ask if they're okay. Hello sir, are you okay? Can you hear me? And if there's no response, we have to shout for help. Someone help me! Help me! Someone's in trouble! If help arrives, ask the person to call the emergency services, which is 999, and bring an AED if one is nearby. If you are alone, call the emergency services yourself first. The next step is C, circulation. So we check for the person's pulse, which can be checked beside the Adam's apple at the neck. So if we've identified that there's no pulse and there's also no breathing, there's a movement of the chest, and maybe the person is either not breathing, either gasping for air, or has irregular breathing, then we will have to start with CPR. If you are not sure if the person has a pulse or if he or she is breathing normally, then proceed with CPR. So we place one of our hands in the middle of the chest area. The other hand goes above this hand, and the fingers interlock like this. And then we will do compression of the chest 30 times. And that it is important that we pivot the movement at our hips and keep our hands straight, so like this. After 30 compressions, give 2 rescue breaths with the head tilt and chin lift method. We can put our hand on the forehead of the person. We tilt their chin up. Pinch the nose and breathe adequately. Continue this process for 5 times and then check the pulse again. If there is no pulse or if you're unsure, then continue doing CPR. If an AED arrives, stop momentarily for the AED to check the patient's rhythm, and after the shock is given, if needed, continue CPR again. Do not stop until you are tired and you have to switch out with another person, or until medical help arrives. How to do a broad arm sling for a wrist fracture. First, ask the patient to hold their injured hand. Gently place the triangular bandage in between the injured hand and the body. Bring one corner around the back of the patient's neck to the opposite shoulder. Bring the corner that's hanging down to meet with this corner. Make sure the whole arm is supported down to the little finger. Tie a reef knot. This is how a reef knot is tied. This is how you untie the reef knot. Twist the remaining corner and tuck it in at the elbow. How to do figure of 8 dressing for sprained ankle. Make sure the rolled dressing is facing outwards so it's easier to unroll when wrapping. Start wrapping at the further part of the foot. Wrap a couple of times to first anchor the dressing. Now wrap upwards and around the joint behind the foot. Bring the wrap back down and around the foot. Repeat this wrapping process. Overlap 2/3 of the previous wrap. Finish the dressing with 2 wrap. Secure the end of the dressing. Here I use 2 pins, but you can use plasters too.